Good snowy morning to you, folks. John Adamson, the Rehab and Documentation Guru. Today is January 11th, and I'm going to show you this winter wonderland. So, driving around early in the morning in my four-wheel drive, bringing my daughter this morning to her 12, well, it'll be more like 13 to 14-hour shift as a nurse at a hospital. I wanted to talk a little bit about patient compliance and informed consent. For some reason, I got on the topic. It's a big, important issue for me. Frankly, it took me a long time in my career before I really started paying attention to the importance of informed consent. Because when I was a young therapist, even though informed consent was still a topic, I'm not that old, it wasn't really thought of as much as it is today. And if you know anything about the delivery of healthcare, you know that before this more modern era of healthcare in the United States, where we are very careful about informed consent, we had more of a paternalistic mindset towards healthcare. So basically, paternalism is what it sounds like. It's like the doctor or the therapist or whomever acting like a father figure and telling the child, i.e., the patient, what to do. Not so with informed consent or shared decision making is a analogous term. So now we are called as clinicians to be sharing our decision making with the patient. So we inform them of what we're offering to them. We're telling them, for instance, what their disability is caused by or dysfunction, and then we're telling them the care plan we believe is necessary to get them back in shape or get them to their goals. And then, as long as they've understood it, they hopefully will follow through or they'll allow us to do that treatment, and then we will get things done for them. So, shared decision making or informed consent. But I wanted to just talk a little bit about how we can maybe make that a little bit better. And it's basically what I'm going to say is probably pretty straightforward and makes sense. There are different models for improving or enhancing patient compliance. Hello, Tyler. Um, one is called the Teach Back method. You can actually find information online about it. Hello, Danny. Um, so, how do we deal with informed consent? How do we make sure that we're getting our message across? So, first of all, information received, okay, information understood, and then information acted upon. And again, this is going to be pretty straightforward. I've had lots of conversations with my family, and those of you that have been following me know that I have a very large family. I have 12 children. If you have children or if you have a spouse, have you ever had conversations where you gave information that you know they needed to act upon, and that person received it, but then they couldn't spit it back to you? They clearly did not, internalize it. I've even had conversations like this with my kids. I'll say something to them, and they will repeat it right back to me, and yet later on they'll go, "What'd you say?" So I'm sure all of you can relate to that. Hi, Sophia. Hello, welcome. So I'm sure you can relate to that quite a bit if you have any family and you're not a hermit in the woods somewhere. So information received. One of the things that I focus on as a therapist with my patients is making sure that I'm clearly understood by them. So, one of the problems that a lot of healthcare workers have, and I've seen this because I've had my kids recently needing a lot of healthcare. I had a child in the hospital for 8 days. He's doing fine now, he's doing well. But while he was in the hospital, I stayed with him. And we had a lot of people coming into into his room while he was there, different caregivers providing different levels of care. And one of the things that was very common was they would tell me what they were going to do without knowing my background as a healthcare provider myself. And the terminology they were often using was rather highfalutin. It would have gone well over the head of somebody without a healthcare background. And so we have to work very hard if we're going to get informed consent in communicating. I've had so many situations where I've had doctors interacting with patients that I've been observing who could not dumb down, so to speak, their language to make sure that the patient actually did receive the information that the doctor was trying to impart. So, the first line of defense for a proper informed consent, shared decision making, is going to be making sure that you're bringing your language down to the level, obviously, that the patient can receive. Don't assume, even if you're dealing with another healthcare provider who is your patient, that they're at the same level of understanding things like abbreviations or what words mean, to help them really grasp what information you're trying to give to them. So informed consent starts off obviously with information received. Now, about how about information understood? How do you make sure that they're really understanding what you're having to say? Have them teach you back, or have them tell you back what you just told them, and not necessarily with the words that you have shared. So ask them to specifically state back to you what you imparted to them, just using different language. Or maybe using an example, for instance, of how the information you've given them applies to their life. So, for instance, you might say, "Look, Mrs. Jones, I've noticed that at walking 100 feet for you is just putting your heart under too much stress. And so I know you're about to go home. Can you think of applications?" I don't know why my windshield wipers just went off. Can you think of applications that may impact that? And Mrs. Jones thinks, well, my mailbox is about 60 feet from the house, so I could walk to that, right, and get my mail. And they might say, well, actually, no, Mrs. Jones. Think about it for a second. If it's 60 feet from your house, you got to walk the 60 feet back, so it's 120 feet. So that's going to be too much for your heart. And so you get them to say the same thing back to you, just in a different way. So you make sure they really grasp the implications. One of the problems that we have, especially with cognitively impaired patients, is taking objective information, which they may be able to articulate back to you, and then abstract it to their life on a daily basis. So you not only want to make sure they've received the information, but they've understood the information and how it applies across the board. And then the last thing is information practiced or implemented, whatever word you want to use. So I tell my kids to do something. They can articulate it back to me. Yes, I shall do this. And then I observe over a course of time that they haven't done it. So the question is, one, are they just being disobedient? Which is a possibility, of course. Or two, is it really that they understood it? So I go back to the previous step. If they're not implementing it, did they truly understand that information so they can apply it to their life in all aspects? Or do they even receive the information? So if I have a patient who is not putting into practice the home exercise program that I have clearly articulated to them, they seem like they understand it, they show me back the exercises, and yet I find out that they're not doing it. Shut up, Gandalf. That's funny, Pastor Paul. Thank you. I need a much longer beard to be Gandalf. So anyway, Pastor Paul, I have no idea who you are, but I appreciate you watching. Um, so you threw me off, man. So anyway, one of the things that we get frustrated with patients very easily is failure of their following our prescription of exercises. Just kidding. God bless. I appreciate you, Paul. So one of the things we have trouble with is getting patients to comply. And if you've been a healthcare worker for a while, you probably came into the field thinking everything I teach my patients to do, they're going to just follow because I'm so excellent. It is not the case. You might be the best articulator of disseminating information that's highfalutin from the big brain you get, down to the level the patient needs it, and yet they just don't follow through. And so, did we really achieve informed consent? Did we get that shared decision making that we're called to do? And the answer is probably no. And so, one of the things I would do is if you get that patient back, let's say a month later, like you've discharged the patient, they had their home program, they they understood it, they demonstrated they could teach it back to you, and yet you get them back a month later because of the same problem and they haven't done it, and if they had just done it, they wouldn't be back to you a month later. The question then becomes, is was there some other barrier to them following through? Did they just plain not want to do it? Is there something else that maybe we should focus on? Maybe we're not thinking about other things in their life, like we gave them this 10-point home program to do, but frankly, they lack resources, they lack time, maybe physiologically, they just don't have the capabilities because of their medical issues they've got. So, over time, we'll be able to see whether the information was actually put into practice, and so that may involve multiple visits, and we have to go back to the previous steps where we give them information, but then we ask them for information and say, you didn't follow this before. I think it'll be helpful. How can we make this more readily followable? Is that a word? It's early Saturday morning. I've only had one coffee. Can we make this more able for you to follow so that you can, keep up doing this and have success in the future? So just a very simple three-step plan. Information received, make sure they actually are hearing you. Unlike, my kids sometimes, if they're older kids, they're on the phone or they're carrying on conversation with somebody else or internal conversation. That they can actually understand it. They've repeated it back to you and in words their own, not necessarily the same words you've given them. And they demonstrate the ability to abstract that information. And then finally, with a little bit of time, assessing whether or not the information has been implemented. And if though all those three things have been done, you have provided proper informed consent. All right, you've been a most enjoyable audience. Hi, Haley. I'm saying hi. So appreciate you watching. I have a Haley. Actually, that's the Haley I brought to the hospital this morning, who is a nurse and on a cardiac and general medicine step down unit. So um, one level below ICU. So anyway, God bless you all. Thanks so much for watching, and I hope you have a great day.